Hello, I'm Dr. J.J. Bleicher, the Interim Chief Executive Officer and the Chief Clinical Officer for Wyoming Medical Center. I'm here to give you an update on the hospital and how things are going with COVID-19. Back in March and April, we had about 4 or 5 patients in the hospital. By the summer, we had 8 to 10. Late summer, maybe 10 to 15. This morning, we have 40 patients in the hospital with COVID. There are 5 in the intensive care unit. And every one of these patients is extremely sick, or else they wouldn't be in the hospital. We're doing everything we can to handle this extra load of patients. We're above where we would normally be. We've had to switch private rooms to semi-private rooms. We've had to get dozens of emergency nurses from outside this area to help us care for that. We have physicians stretching, changing their roles, everything they can to help us care for these patients. Luckily, at this point, we have enough of the personal protective equipment, or PPE. Banner is helping us with that. So we're able to keep all of our staff safe within the hospital. But just like the community where COVID is running rampant, we have staff who are also getting sick. So at the same time that we're getting extra staff, we're having to replace staff that's out. This is an extremely difficult situation for us. We are already having to decline calls from out of state, because the states around here are extremely full. South Dakota, Nebraska, Montana, Utah, we're getting calls daily to transfer patients into our state. We do not have room to take care of those patients. We're also having to look closely at our ability to handle patients within the state. The final stages of this, which I don't know when that will occur, we're somewhere in the middle of a surge. I don't know when the peak is going to come. And I don't know because nothing seems to be changing outside the 4 walls of the hospital. You see I have a mask here. We wear masks, we do everything that we can, but if the community is not changing what they're doing, these numbers will continue to skyrocket. There is nothing to show that they're going to change. What is happening over the last week is a doubling of the number of positives within Natrona County. Those won't hit our ED for another week or so, and we're already, as I said before, at 40 positive COVID patients, which is almost 30% of the current patients in the hospital, which is by far the highest percentage of any disease that we've ever had within this hospital. So as this continues to stretch and be a problem, we're going to have trouble taking care of just patients from Natrona County. Our ED will be backed up, and people having heart attacks, strokes, complications from cancer, other infections are not going to be able to get in through the ED if we don't change what we're doing. This is getting to be extremely dire. We're stretching and stretching, but we'll get to a point where we're going to break and not be able to do more. So we're imploring you to please change what you're doing out in the community so that we can bend this curve, as we were used to. That was our favorite phrase in March and April. Right now, we're doing exponential. Things are growing, and we are not going to have room. So to restate, we can't take things from out of state. Soon we won't be able to take things from out of the county, and at some point, if things do not change, we will not be able to take care of the patients within Natrona County.